Trump's Tylenol advice when politicians play doctor. On 9/22/2025, President Trump stood at the White House podium with Health Secretary RFK Jr. and announced that the FDA will notify doctors that acetaminophen used during pregnancy can be associated with a very increased risk of autism. He repeatedly told pregnant women, "Don't take Tylenol, don't take it, fight like hell not to take it." And he suggested breaking up childhood vaccines, claiming, "It's too much liquid, too many different things are going into that baby." This wasn't medical advice from a doctor, but millions heard it as if it was. Now, I'm Dr. Rose. I have a PhD in medical science, but not that kind of doctor. I can explain drug mechanisms and study design all day, but I can't prescribe you so much as an aspirin. So don't take medical advice from me, but I will give you this one piece of guidance. Don't take medical advice from him. Remember COVID? Inject bleach, anyone? How'd that work out? Health officials across the globe rejected Trump's warning faster than you can say hydroxychloroquine. The European Medicines Agency flatly stated, available evidence has found no link between the use of paracetamol during pregnancy and autism, and the strongest science backs them up. A 2024 JAMA study analyzed 2.5 million children in Sweden, even comparing siblings, and found no association between acetaminophen use in pregnancy and autism, ADHD, or intellectual disability. Yes, some smaller studies show associations, but associations aren't causation. It's like how ice cream sales and drowning deaths both rise in summer. Ice cream doesn't cause drowning. Scientists put it plainly. The better controlled the study, the less likely it is to find even a small risk. When researchers control for genetics and environment, the links vanish, faster than Trump's medical credentials. That's right, he's got a medical degree from Trump University. Welcome to Burden of History, where we examine the evidence behind the headlines with slightly less drama than a White House press briefing. If you're new here, welcome to the circus. If you're returning, thank you for staying sane with us. And if you haven't subscribed yet, please consider it. Your support helps us navigate complex issues with facts, not Twitter medical school. Medical advice from the White House carries weight. Acetaminophen is the safest pain reliever option for pregnant women, according to doctors and the manufacturer. Without it, women face dangerous choices, suffer through fever, which can cause miscarriage, birth defects, or premature birth, or turn to riskier alternatives. But hey, just tough it out, right? That's what people said about polio before vaccines. The Trump administration cited an August 2025 meta-analysis suggesting prenatal acetaminophen may increase risk. But even those authors said their work does not prove causation, and they did not recommend pregnant women stop using Tylenol. It's almost like scientists understand nuance better than politicians. Wild concept, I know. That's how science works. Cautious, evidence-based, acknowledging uncertainty. Politicians, on the other hand, work like this. I saw it on Facebook, therefore it's true. This fits a pattern we've seen before. Trump repeated debunked claims about vaccines causing autism, despite decades of research showing no link. He made false claims about autism in Amish and Cuban communities, both of which have documented cases. Next, he'll probably tell us the moon landing was faked by Big Pharma. The scientific process is messy and gradual, like trying to assemble IKEA furniture with instructions written by someone who's never seen furniture. Politicians, on the other hand, thrive on certainty and drama, like reality TV, but with nuclear codes. When those worlds collide, public health suffers, and we get gems like, maybe we should look into injecting disinfectant. Trump's announcement created confusion among doctors and fear among pregnant women. Exactly when clear, evidence-based guidance matters most. Medical decisions belong between patients and doctors, guided by evidence, not by politicians who think they can cure cancer with positive thinking and a good tweet. If this analysis was helpful, like, comment, and subscribe. Because at Burden of History, We believe facts, not fear, not Facebook, and definitely not a president with imaginary medical degrees should guide our choices. And hey, if Trump really thinks Tylenol causes developmental issues, maybe he should tell us how much he took as a child. It might explain a lot.